Residents' rights and abuse. The Nursing Home Reform Act of 1987 strengthened residents' rights. It ended Medicaid discrimination. Nursing homes were paid less by Medicaid, so they weren't so excited about taking Medicaid patients. It mandated training. We have nurse aid training now. It supports the quality of life. It has surveys on actual care in nursing homes, which we have every year. The state comes and measures how well we're doing. And it enforces standards of quality. Residents' rights can be broken down into 9 sections: being fully informed, participating in care, making independent choices, privacy and confidentiality, dignity, respect and freedom, security and possessions, transfers and discharge, complaints, and visits. The right to be fully informed. Residents are informed of their rights at or before admission, and it's done orally and in writing in language that the resident can understand. Residents' rights are posted here at Divine in view of the residents, staff, and visitors. It's right across from the nurses' station. Residents are informed about the process for making complaints, so they know they can complain about the nursing home and how to do it and who they would complain to. Like the state of Minnesota, they could do that, or to the ombudsman, they can do that. And an ombudsman is someone who defends residents' rights and also works with their families. Advanced directives. They receive information on this. They see that what the facility's written policy is on that and how it applies to our state law, and they formulate their own advanced directives. They need to know the cost, what's included in the daily rate, for example, nursing services, meals, rooms, laundry, and what are extra costs, like the phone, the computer, the beauty parlor. They get information about Medicare and Medicaid. They're talked to about their right to receive it and when they're eligible for it. And they are given a written consent for all the items and services included. Residents can review the state survey in our nursing home. It's across from the nurses' station in a notebook that's against the wall, right next to the residents' rights. Notice of potential loss of Medicaid eligibility. They need to be notified if for some reason they'll be losing their Medicaid. They're notified in advance of any kind of a room change or roommate change. They have the right to refuse this. They have a right to participate in planning in the move, and they have the right to have their preferences met. Notice of condition change. Any kind of accident involving injury to the resident, some sort of a change in physical, mental, or psychological status, transfer or discharge, the facility must contact the MD, legal representative, and the family. Equal access to quality care. Regardless of the source of payment, the facility must maintain identical policies and procedures regarding transfer, discharge, and service. Sensory impairment. Residents that have problems seeing need to have their glasses working. They need to have them cleaned, and their hearing aids need to be working. Nurse aides need to make sure that they're working and put new batteries in them as needed. They have the right to participate in their own care. They should receive appropriate care. If they need a wheelchair, they should have that. If they need a walker, speech therapy, physical therapy, any other types of care that they could use that would be appropriate for them. Continuity of care. They have the right to have reasonable and regular assignment of staff to the resident, have the same nursing assistant and nurses working with them. They have a right to have a relationship with any other health service or supplier. So say they want their chair from XYZ Enterprise, they can have that chair. They don't have to buy it through the nursing home. They need to be informed of any changes in their medical condition. They can participate in planning, treatment, and discharge. And we do this at the nursing home with care conferences to plan their plan of care. It gives them a chance to communicate with an MD through one of the nurses, and also gives the family a chance to have input on their care. They have a right to refuse treatments, medication, diet, general treatments, must inform of any kind of complications for the refusal of the treatment. Let the physician know and have it documented on the chart. They have a right to refuse chemical and physical restraint. Medications that can alter your thoughts are considered a type of restraint. and we can't use those medications just for convenience, for also as discipline measures. And restraints that can restrict their movement are also something that a doctor would need to order, or we would use in an emergency. Residents can administer their own meds if it is safe for them to do so cognitively. Most of our residents here aren't able to do that. There is a right to review your medical record within 24 hours of request, and you can purchase photocopies, which should be ready for you in 2 working days. They should be responsive to services you need, prompt and reasonable responses. They should answer your questions and your requests. They have a right to refuse experimental research. The right to make independent choices. Making independent personal choices, like which activities you want to participate in, when to schedule your health care needs, when and who to interact with, and feel you have some sort of control over your life. We need to accommodate needs of the residents. The facilities must meet their preferences and needs unless there's some sort of health safety issue. So if they want a bath instead of a shower, we need to accommodate that. That shouldn't be a problem to handle. The facility structure, temperature, and cleanliness need to be comfortable for the resident. And if it's not, we need to do something about it. Married residents have a right to share a room, and they can have private visits by their spouse. They can have time alone in their room when they know they won't be bothered. You have the right to choose your own physician. The facility must provide names and specialties of physicians that you request that maybe aren't the normal type of physician, like a voodoo doctor or something, but they do have the right to get that phone number and business address. The right to make independent choices. Residents must be informed about care and treatment that is going on in their lives. They have a right to have information on treatment, alternatives, the risk, prognosis, and diagnoses from their physician. Residents have the right to refuse to work, and if they do work, it needs to be put in their plan of care. They could work, possibly say they had physical issues that made it unable to do a lot of jobs, but they still work cognitively with it. They could be an accountant, for instance, and then they would get paid the going rate for an accountant, even though they were a resident at the nursing home. They have the right to make independent choices. They can participate in social gatherings, religious gatherings in the community, as long as it doesn't interfere with the rights of any other residents. They can participate in resident and family groups, like resident council. They're allowed to come to the council and have any issues they want discussed. They have a right to vote without any kind of interference, coercion, discrimination, or reprisal for exercising their right. You can't tell them, well, you can't vote for candidate A, otherwise I won't give you dinner, that kind of a thing. Right to privacy and confidentiality. They have a right to communicate with any kind of government representative, ombudsman, family and relatives, their government representative, a physician, by mail or telephone. In the telephone, a lot of times they'll call and we answer at the nurse's station, and it's a relative. We'll have them go into the blue dining room for some quiet when they're talking with their relative. Mail. They have privacy for the written communications. They have privacy in sending and receiving mail. It should arrive to them unopened. They have access to mail and stationery to write on for their mail. Often we have residents that eyesight isn't so good that the aide would take the letter with permission of the resident and read it, or the social services will do that too. Personal privacy. They have the right to privacy in their cares. We make sure we pull the curtains and close doors when we're working with the residents. They have a right to be treated as an individual. If they have requests of what they want done when, if it's possible, we should do that for them. They have right to have social, religious, and psychological privacy, and the staff must knock on the door before entering the room. Private information would be their medical records. They need to be notified when records are needed to approve or release or refuse release of records. They need to transfer, they must release their records. The law, if they were to request their records, would be able to have them. Financial information, again, they need to give permission for, and personal affairs. Right to dignity, respect, and freedom. Our residents should be treated exceptionally well. Our attention should be on the client. Like if we're eating in the dining room, instead of having two people talking back and forth while they're feeding a resident, two co-workers, they should be concentrating on their resident and talking to their resident. They should have respect. They should have dignity. They should feel worthy of esteem, and they should feel honored. They should be free from abuse. I'm going to go into abuse in our next talk, more so than I am now, but they should be free from any kind of mental, physical, corporal punishment, involuntary seclusion, physical and chemical restraints, verbal or sexual abuse. The staff treatment of residents. The incidents of abuse, neglects, and injuries of unknown origin need to be investigated and appropriate action is taken. And they have a right to file complaints. And as I said, I'll go more into this in our next talk. They have the right to self-determination, personalizing their cares, choosing activities, choosing their schedule, choosing who they'll socialize with, personal possessions and clothes, and comfortable environment. Here is a clip from a movie called 7 Pounds, and I guess the point I'm trying to get across with this clip is how to treat your resident. Let us go over to a different. Okay.
Inez, look at me, please. Inez, I'm speaking to you. I understand you refused to take your meds again this afternoon. Is that true? No. Let's try using your words this time, okay, Inez? I mean, this silent treatment isn't doing anybody any good. Inez, how can we help you if you... Okay, how about I come back tomorrow and see if you've changed your mind, okay? Ma'am. Inez, look at me, please. Inez, I'm speaking to you.
And the second part, which is the way we should be treating our residents. He actually knocks on the door. I just didn't get it in the clip.
Hello? My name is Ben. I totally understand if you don't want to speak to me either, but I'd really like to just have a moment of your time. Figure out what kind of man Stuart Goodman is. It is within my power to drastically change his circumstances. But I don't want to give that man a gift that he doesn't deserve. I need you to tell me whether or not he is a good person. Gives me makes me dizzy. I want a new one. Well, that sounds very reasonable, Inez. Trust me. What else, Inez? Punishing you? How is he punishing you? How is he punishing you, Inez?
Ben? Hey, Ben, where you going?
Where's the washroom?
To the right. Is there a problem?
Give her a bath. Right now.
Absolutely. Thank you. Ben, I think you have the wrong impression here.
You want to stop by from time to time? Make sure you're showing these people some goddamn respect.
This is a misunderstanding, okay?
Don't treat people like that.
Let me explain, okay, Ben?
I'm not giving you an extension.
Ben!
I'm not giving you anything. I almost believed you, you son of a bitch. I almost believed you.